I recognize the honourable member for Dartmouth North.
Madam Speaker, here we are embarking on yet another month without any update to the Need a Family Practice Registry. In June, when the list was last updated, 16.2% of the population, more than 160,000 Nova Scotians, were on the waiting list, waiting to be attached to primary care. I can table that. This government can play around with the data all it wants, but the fact remains that the healthcare crisis in this province is worsening, and people want to know when things will get better. Now, we didn't hear an answer from the Premier, so I'm going to ask the Minister of Health. To the Minister of Health, why won't this government release an update to the Need a Family Practice Registry?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. I thank the member opposite for the question. So as we did last summer, we have undertaken a validation exercise. So the people that are currently on the Need a Family Practice Registry are now being called to have their information validated. We want to understand whether or not they have already been attached, because the functionality of that list needs to be improved, and we continue to do that. We're understanding their health status. We're understanding all the situations that lead them to be on that registry. It is moving from a list that was never looked at or managed to a registry that allows people to connect to primary care in order to connect to chronic disease management, prenatal care. It cannot be rushed, and we're doing a wonderful job through Nova Scotia Health, and when those numbers are ready, they will be released.
I recognize the honourable member for Dartmouth North.
Madam Speaker, last spring the Premier indicated his government might scrap the Need a Family Practice Registry altogether, and now the health authority has been reviewing the registry for months, trying to remove people from the list. The last time this government reviewed the registry, most were removed because of invalid health cards, and many others were mistakenly removed. Can the minister explain why this government is spending more time hiding and downplaying the list than it is working to actually attach people to care?
I recognize the Honourable Minister of Health and Wellness.
I don't think calling all of the individuals who are on that registry to find out more about their health care is hiding. I actually would say that that is patient-centered care, and I'm very proud of the work that's happening around validating that list. What's important to understand about that list, and to quote the Honourable Dr. Jane Philpott again, Nova Scotia leads the way on access to primary care, literally calling everyone on the registry to validate details, assess risk, provide interim measures as they recruit and build primary care teams with the end goal of a health home for every community. Other provinces, take note.